Queen Silver Springs has been serving yummy foods and ice cream made fresh to order for 46 years. Their gift cards are perfect for those you love for any occasion. Our ice cream cakes are awesome. And as far as grilled foods, DQ does it right. From grilled chicken to our famous foot-long chili dogs. So come on down to Dairy Queen Silver Springs, where we always treat you like kings and queens.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
You know, sometimes I pick bumper music just at random. I have no idea what it's going to sound like. I just don't think this fits fetal surgery. I just don't think this I mean, fetal surgery, it should be something very subdued. It should be classical or something.
I know, but it fits Dr. Adzick. He's a cool doctor.
Yes, Dr. Scott Adzick has been with us before. He's on the phone right now. He's the surgeon-in-chief at the Children's Hospital of Philadelphia, one of the most amazing hospitals in this country. And today, he's talking about fetal surgery. I just can't even imagine how delicate of a procedure this must be. January, it says here, is Birth Defects Awareness Month. So let's find out from Dr. Adzick what we need to know. Good morning, doctor. Good to have you back.
Good morning. It's great to be back. Thanks for inviting me.
How's the weather in Philadelphia?
You're rubbing it in. About 45 degrees, gray, overcast. But that's a good environment to get some good work done.
Just the thought of fetal surgery, it wasn't even something we would have considered some years ago, right?
Yeah, it really, the ideas were started at University of California, San Francisco. I was there. This was in the early 1980s, and we did work in animal models and then eventually developed the specialty. But this is, January is Birth Defects Awareness Month, so the key points about birth defects, what your listeners may not know about, is that, first of all, 1 in every 33 babies is born with a birth defect. So they're amazingly common. They're costly. Billions of dollars are required for medical treatment of birth defects. Birth defects are merciless. No parent is immune. They're mysterious. Most causes of birth defects are not known. They're overlooked. In my view, research is underfunded. And birth defects are deadly. They're the leading cause of infant mortality. So if you do the math, each year nearly 150,000 babies are born in the U.S. with birth defects.
Wow. And does the fetal surgery part of preventing them save lives? Can you somehow give us a number? Like, if a parent was reluctant to have fetal surgery on the baby, would they be risking something as opposed to waiting for it to be born and then perform the surgical procedure?
Well, the rationale for fetal surgery is that there's a life-threatening birth defect that causes progressive organ damage before birth, and if you wait till the time the baby's born, the baby's not going to make it. Or there are certain devastating birth defects, like spina bifida, for example, where there's ongoing damage to the exposed nerves and spinal cord in the back. And if you do the operation to close the spina bifida before birth, the outcomes are significantly better than if you wait till the repair after birth. But spina bifida surgery before birth is not a cure. It just helps ameliorate or prevent or mitigate some of the problems that occur.
Is that a hard sell for the parent?
Well, they have choices, of course, and so we want to counsel in a way that we support whatever they want to do. And to put it in perspective, we this year at Children's Hospital of Philadelphia, or CHOP, will evaluate about 2,000 mothers carrying fetuses with serious birth defects. But really only about 10% will be fetal surgery candidates. Usually the birth defect can be managed by serial observation, by ultrasound, planned delivery here at CHOP in our special delivery unit, which is specially crafted for this sort of thing, and then prompt treatment of the baby after birth. So fetal surgery is just reserved for certain indications.
Are birth defects hereditary, and if a baby is born or being acknowledged to have a birth defect while in the womb, does that mean that the parents will generally elect not to have another child, to have this baby but not another one?
No. Anatomic birth defects, which are largely the ones that we deal with, are random. The causes are unknown, and there's usually no increased risk for a subsequent pregnancy. Genetic birth defects, however, say like cystic fibrosis, there could be, for instance, in cystic fibrosis, if both parents carry the recessive gene, there's a 1 in 4 chance that baby will have cystic fibrosis.
Can you tell if the parents are carrying that gene? Are there some tests they can do that before they, get pregnant?
Yes, there are. First of all, amniocentesis, of course. Second of all, chorionic villus sampling. Third of all, the most amazing test that it will eventually do the things that amniocentesis and chorionic villus sampling do is a non-invasive prenatal testing, or NIPT, where you draw a blood sample from the mom. And there are cells that leak from the fetus across the placenta into the mother's bloodstream, or fetal DNA as well, and those can be retrieved and analyzed, and you can use that to diagnose various trisomies, 21, 18, and 13. But with time, that'll become more sophisticated to diagnose virtually any genetic abnormality with a blood draw from the mother.
Some of the parents who might be listening right now, obviously, if they've turned up the volume on their radio, they're going through something right now that's scary for them. So can you advise them about taking their baby up to Philadelphia to the hospital that you're at? Or do we have the same kinds of procedures available here? What would you suggest to them?
Well, first of all, information is important, and that can be provided by their maternal fetal medicine specialist, or you can go to our website, for example, at CHOP, which is fetalsurgery, one word, CHOP.edu. So fetalsurgery.chop.edu is a good place to start. We specialize in just very serious birth defects that may be amenable to fetal therapy, and so spreading that information, like on your radio program, is really important, because you can imagine if you're a mom and you have an ultrasound done in 18 weeks and there's an anatomic problem. Many of these conditions are so rare, most parents and even some clinicians don't know too much about them. So too often these families are made aware of the treatments available at a place like our center, and they're left feeling overwhelmed with a few options. So education is really important.
And what is the mortality rate of the fetus that has undergone surgery?
Well, it varies by the birth defect, so we can talk about a couple. One is twin transfusion syndrome, TTTS it's called. So the setup there is identical twins in the uterus, each in their own amniotic sac, and as opposed to each twin having its own placenta, the hookup with the mom, they have a shared placenta, and there are unpaired blood vessels that go from one side of the placenta to the other, such that one fetus, one identical twin, gets too much blood and goes into heart failure. It has an abnormal amount of amniotic fluid, and the other twin goes into kidney failure because it's not getting enough blood, and there's no amniotic fluid, and it becomes stuck and shrink-wrapped in the membranes. And so those twins will go on to die.
Oh, my gosh.
Unless you put in a scope, a fetoscope, through the mother's abdominal wall, through the uterine wall, visualize the placenta with the scope, and then use a laser fiber to photocoagulate or occlude those culprit blood vessels. And the outcomes for twin transfusion fetoscopic laser therapy are very, very, very good. Another example would be fetal surgery for spina bifida. So spina bifida occurs when the covering around the spinal cord doesn't form properly, so the spinal cord is exposed to the amniotic fluid environment, and particularly during the last trimester, the third trimester, that fluid, which is mostly fetal urine, causes severe damage, ravaging neurotoxic effects on the exposed spinal cord and the nerves. And so we've learned that if you repair this in properly selected patients before birth, you can mitigate many of the problems that you see in babies who are treated after birth. Those are eventually the wheelchair kids, so that they have better motor function, those treated before birth. They are more likely to be able to walk, less likely to have hydrocephalus and brain damage, much less likely to require a shunt tube to drain fluid from the brain into the abdomen, for example.
Wow.
Oh, my.
You're amazing, Doctor. Thank you for chatting with us about this. For everybody who turned up the radio, you've got a child or one of your daughters is pregnant or something, and you just want to know more, the website is chop.edu. Is that correct, Doctor? Chop.edu?
It'd be more specific to be fetal surgery, one word, .chop.edu, or you could, if a diagnosis of a birth defect has been made and you want advice or an evaluation, you can call 1-800-IN-UTERO.
Okay. And just for those who didn't pick up on it, CHOP is the acronym or the abbreviation for Children's Hospital of Philadelphia. Dr. Scott Adzick, thank you again so much.
Okay, thank you.
You're welcome. We'll be right back.